So they see these reels and everything is edited so well. And
there's so many filters, layers of filters they don't show.
Yeah. If I have straight hair, I want to go to the parlor, get it all curled up. Someone who has really good curly hair, they want it like Barbie straightened.
They suffer from it, but they don't know what body dysmorphia is.
Only a dermatologist and a plastic surgeon can do hair transplant. He has gone to different plastic surgeons and has been operated 23 times. There are patients who are having gender identity crisis. In these patients, we can help a lot. Don't have any unrealistic goals. Stick to what your doctors are saying.
Today I can just wake up and I can tell them, I'm gonna go and inject Botox into her.
Shah Rukh Khan probably has a foundation who is what is helping acid attack survivors.
Welcome to Truth Forecast, where the mind is without fear. Today we're going to talk about the modern beauty standards and the rising trend of trolling and body shaming invading social media platforms. Let's start. Today we have with us our very first guest, renowned plastic surgeon Dr. Arno Mondal.
Hello.
And prominent dermatologist Dr. Akansha Barua. Most welcome to the show. So first of all, we would like to start with you. A little bit of introduction about your professional background and anything that you would like to say about yourself.
Well, I am a practicing plastic surgeon in Kolkata. I did my postdoctorate from Medical College, Kolkata, and then I work in a government hospital as well as work in different private setups in Kolkata. And apart from my day-to-day work, I have one hobby. I do painting, and more or less this defines myself.
That's very nice, painting, plastic surgeon and painting. But I think being a plastic surgeon, you need to be creative, right? And
yes, of course.
Painting also at the same time. Both of
Plastic
them are
surgeon
art,
should
actually.
be creative, as well as the plastic surgeon should have a vision of what he is going to give the patient.
So you're more of an artist, less of a doctor, which one?
No.
Artistic doctor would be the right.
Primarily, we are all doctors.
Okay, thank you so
Other
much.
things are secondary.
And Akansha, how about you? Your professional background, what you're doing right now, and anything that you would like to mention.
I am Dr. Akansha Barua. I am a consultant dermatologist and cosmetologist. My special interest is definitely injectables, but I would like, I think the aim of my life right now is to make skincare more accessible, less confusing, and at the same time make people look and feel good in their own skin.
Oh, it's so wonderful. That is, I think, what people need now. They need to be more comfortable. They need to be more acceptable towards their
Ease
own
of things,
self, right?
right?
Yeah. So the first question for you both. So compared to 20 to 30 years ago, what do you think is the beauty standard now? The so-called modern beauty standards. The three requests which you get the most, depending on maybe the three different types of plastic surgery for you, maybe the three different type of treatments which are most common. So, sir, we'll start with you again.
Okay. The first question is basically the most difficult one. What is beauty? Actually, it's very difficult to define beauty. And this can take a whole session, isn't it? This can take a whole session. Beauty, to me, what I feel, beauty is a combination of good body proportions and facial proportions. But along with it, it should have certain other things. Like what I believe, beauty means a bit of grace, educational background, as well as intellect. This all comes in the definition of beauty. So it's very difficult to define beauty as such. But I believe these three things are very important to define beauty. And as you were saying about the beauty standards actually have evolved throughout the human civilization. There is a book written by Umberto Eco on beauty. It's a very nice book. এই বইটাতে যেভাবে দেখিয়েছে যে how beauty has evolved হ্যাঁ, from the prehistoric times, in that time বিউটির স্ট্যান্ডার্ড কি ছিল? বিউটির ডিফাইনিং স্ট্যান্ডার্ড ছিল ladies with big breasts and white pelvis, because at that time beauty was associated with childbirth. তো সেখান থেকে বিউটি ইভলভ করেছে ফ্রম দ্য টাইম অফ দ্য গ্রিক্স, দ্য রোমানস, দেন দ্য নর্মাল টুডেজ মডার্ন সিভিলাইজেশন। বিউটির স্ট্যান্ডার্ড কিন্তু with time it has evolved, it has changed. And if you see 1950s Hollywood or Bollywood and see today's Hollywood or Bollywood, every in this modern world, every 10-15 years the standard of beauty is changing. Standard of beauty is changing. Initially people thought that beauty means very skinny, কিন্তু এখন সেগুলো চেঞ্জ হচ্ছে। There are lots of plus size models also who are working very nice. So our attitude and perception of beauty is also changing. So আমার মনে হয় যে if someone can carry himself or herself with dignity, that is beauty.
It's very, very nicely defined. And Akansha, as per you, what do you think?
I think beauty is all about feeling real in today's
Exactly.
world. It's feeling yourself. So I think in the last couple of years, a lot has changed, and the definition of beauty keeps evolving, and it has become global right now. So there are different skin shades which are being accepted, skin textures being accepted, textures of hair, body shapes, which are not only getting accepted, but I think it's getting celebrated. So if you talk about the top model of 2025, I believe her name is Unqualified, and she happens to be a woman of black origin.
Yes.
And I think she is the second black model who's opening the show for, I think, huge brands right now. So I think as rightly pointed out, the definition of beauty is evolving, and a lot has changed in the mentality of people as well in the last couple of years, and people are more accepting now to different changes. And I think you asked about the three
The request which you get.
although we all say we are more accepting to beauty standards right now, I think the top request obviously comes for skin lightening. Even if you open matrimonials, even today, they will always, I think the fairness is the first adjective which you get.
Yes.
Want a fair, then the other adjectives come, tall and educated.
Sadly this is true.
For our son, which can be anyone. But I think fairness. So I've spent, I think, about a decade in South India. And I think they also have a different craze. I think in East India, it's a little less compared to the South, but it's there. And it's very evident in the matrimonials. So skin lightening treatments is the top request, and it's been there for quite some time, more than a decade, I think. And people want to go to any lengths to lighten their skin color. It can be IV glutathione, although we tell again and again that this is very temporary. Your skin color is what you live in. We can change you to this shade, but then it's going to come back.
Go back to whatever
And
it hurts.
people say it's okay, let's just get married and then we are
Then
okay. So today's world is superficial. So first, cosmetic treatment is for skin lightening. Second, I would say, I think Korean glass skin.
Oh yes, the
Yeah,
craze.
the
It's a
craze
very
is-
in thing
it's-
right
yeah.
now. Yeah.
So they see these reels and
Yeah.
everything is edited so well. And
There's so many filters, layers of filters they
yes,
don't show.
yes, yes.
Yeah.
so Korean glass skin is the second one, and I think the third one is laser hair reduction,
Yeah.
which is I think a good thing in because so many patients suffering from hirsutism, and a lot of transgender clients are there. They want to change their identity. So third, I would say laser hair
Laser hair
reduction.
reduction.
Yes.
In our practice, what we mostly get is patients of hair transplant. Hair transplant, then some patients for liposuction also, to alter their body shape.
Body shape.
Mostly for
Yeah.
males for gynecomastia as well as abdominal fat, and female for abdominal fat. And third, I think probably breast augmentation or breast reduction, breast augmentation with implants or fat filling and breast reduction. And there are certain transgender cases also who want some change in their external appearances. This is most common we get in plastic surgery practice.
That's very nice. So the next question is, are people happy with their natural bodies, their natural complexion, the hair, straight hair, curly hair? And some people, I think they are unhappy in the way they look or happy the way they look, irrespective of how others perceive them to be. So I would like you to elaborate on that, what kind of thoughts your patients have when they come to you. Like, we'll start with Dr. Ansha.
So obviously the grass is always greener on the other side. If I have straight hair, I want to go to the parlor, get it all curled up. Someone who has really good curly hair, they want it like Barbie straightened. So yeah. But global studies, they do say 60 to 70% of the people are not happy and would like to change at least one feature about their physical appearances.
Wow.
So since time immemorial, females, they struggle more with the body weight and skin. But for males, it's mostly the body structure and hair loss, baldness. And so it's been there. But now there have been a few changes, especially we have to thank social media and even the internet because like sir rightly pointed it out, plus size models, and they don't have a fashion show just for the plus size models. Bigger brands, they have normal size models. Along with that, they have plus size. They are women with brown skin, black skin. So people are okay with the idea of acceptance, but we still have a long way to go.
Yeah. So how about you? What do you have to say about this? Like, how many times have you seen actually patients come to you and you see them and you think they look perfect, what's wrong? And they tell you, I'm not happy with it, I'm not. So
this happens very frequently.
Yeah.
This is a very frequent thing. People usually, most of the people are happy with their body proportions and everything. But there are a lot of people, still there are a lot of people who are not happy. Who want to change, maybe even change in some unrealistic way. But that's, of course, the duty of the doctor to tell the patient that this is real or this is unreal, or we can achieve up to this, or we can not achieve this. We can achieve this, we cannot achieve this. So it is a duty of the doctor also to say that we can achieve this or we cannot achieve this. But there are patients' demands about lots of unrealistic things also, due to social media influences.
Can you give a few examples? What are these unrealistic demands that patients actually come
He'll
with?
have a lot, I think.
Most probably they think plastic surgery can change this and make me look perfect. So what are the
actually, there is a concept people have that plastic surgery can change anything. বাংলা সিরিয়ালে হয় যে একজন অ্যাক্টর যখন সেই সিরিয়ালটা থেকে চলে যায় তো আরেকজন অ্যাক্টর এলো
soaps because the entire face changes.
সেটা তখন বলা হয় যে অ্যাক্সিডেন্ট হয়েছিল, তারপরে তার প্লাস্টিক সার্জারি করা হয়েছে এবং অন্য মানুষ হয়ে গেছে। তো এগুলো তো অনেক ইনফ্লুয়েন্স করেই মানুষকে। আমরা এরকম পেশেন্ট দেখেছি যার হয়তো 3-4 বার কারেক্টিভ রাইনোপ্লাস্টি হয়েছে। হ্যাঁ, স্টিল দ্যাট পেশেন্ট knows to be more perfect, and there is no definition of perfect. So, but a lot of people are unhappy. আরো অনেক সময় হয় particularly in male normal patients, absolutely normal, but they think they have gynecomastia. They want liposuction.
So we'll get define.
That means enlargement of male breasts.
Oh, okay.
So they want liposuction, but the person is completely normal. It's absolutely normal, but they want that.
It's a perceived problem.
It's a perceived problem. This is what we call as dysmorphic body proportion. This is very common.
And also, do you feel that these problems can be solved by going to the gym or maintaining proper diet? So
A lot of these
basically,
problems can
can
be
be solved. But
solved.
they are basically looking for a easier way out where they just go, they do the plastic surgery and they think the problem is
I
going to be
don't say
solved.
it's an easier way out. They still have to do the lifestyle modifications. And the thing is, they are all going for perfection. But being perfect doesn't mean that it will make you look beautiful. In fact,
Absolutely.
yes.
Absolutely.
In fact, there was a study where they had 100 faces. So I think 95 to 97% of us have not perfect faces.
I'm telling you one thing, just I'm interrupting you. If there is something imperfect that makes the
More beautiful.
that makes more beautiful, that makes another person to look more than once.
Yes.
So,
So
The smile of Mona Lisa is not perfect also. There are lots of studies that this smile, there is one study that this is a kind of a paralysis in the face for which the smile is like that. But Mona Lisa is beautiful. So people have to know that everything is not perfect and imperfection makes a man
perfect
or a person
is
beautiful.
perfect isn't equal to beautiful.
Exactly.
So this
Right.
study where they collected 100 pictures of people, and they were all of us are imperfect. One side of our face doesn't match the other
Yes.
side. So what they did is they cut the faces into half and replicated the other side. And they came to know that the imperfection was making the face look more prettier, more beautiful.
Oh.
And if you have the exact angles, exact jawline as the other half, it will not make you look good.
Interesting.
So, yes.
Yeah. So when they say certain actors have like the exact, the same replica on the other side also, and the most perfect looking man or perfect looking woman, it's incorrect,
Yes,
basically.
and you don't tend to remember that face.
Yeah.
You tend to remember a mole on that face. You tend to remember a dimple on one side. If one eyebrow is more arched than
Or
the
two
other.
different eye colors, yeah.
There's a study that the most perfect face of today's world is the face of Amber Heard.
Go. Wow.
There is a study,
Yeah.
and it showed that her facial proportions are most perfect,
Yeah.
but she's not
She's
among
not the most
among
desirable, I think.
top 10.
Prettiest, yes.
Yes,
I am
or the
so
prettiest.
almost sought after. let's
Sought
say.
after, exactly.
But while we are speaking on dysmorphia, you both have been at specializing in your job, say for a decade or so now. What do you say, more than that, and of course, but would you say cases of body dysmorphia has increased over the past decade? Or is it just that people are coming out and talking about it more?
People are now coming and talking about it. Probably.
It's always been there, but
So
now
much.
people
So
are
I
more
think,
vocal about it.
Before we answer that, can you define what exactly body dysmorphia is? Because I think a lot of people have heard it, talk about it, but they don't know what exactly they suffer from it, but they don't know what body dysmorphia is. So if you could just define it in a
definition
few
is a bit difficult, but body dysmorphia is basically one is constantly not happy with his or her body images. That is body dysmorphia. And we get a lot of patients of body dysmorphia. Even I have seen a patient who has done corrective rhinoplasty for nose, person who is a serial actor, Bengali serial actor, and he has performed, he has gone to different plastic surgeons and has been operated 23 times. Still
He's still
not
on the
happy.
nose.
And still not happy. And he has sued most of the plastic surgeons.
Oh,
So 1 second, I shall interrupt. 23 on the nose.
just
on the nose.
Just on the nose.
Wow,
So
he
it's
seems
like,
to have beaten Michael Jackson.
yeah, exactly.
So no matter what you do, you will be unhappy in your skin.
Yeah,
Yes.
and skin. Yes. So body dysmorphia, the first time I came across the term was when I started going to the gym, and then a lot of people seem to be having body dysmorphia, especially if they start going to the gym. And then that is when I started researching what it is, and I got to know that the more the people get into workout and stuff like that, more they get into body dysmorphia, where it does not even exist. It's just in their mind. It is not something that is happening to them, but they feel that way. Why do you think people trust unqualified skin artists or aesthetic technicians more than dermatologists, cosmetic surgeons, and plastic surgeons? And what reason is it? The cost, the speed of recovery, which they are told maybe it's going to be faster, or Most probably it's the money, is involved. So what do you
Most
think?
of the cases, it's money.
Okay.
Because unqualified person, that will be cheaper. Of course, that will be cheaper. Another thing is, in most of the cosmetic procedures, you won't get the help of Medicare. Most of the people have Medicare, but these cosmetic procedures or aesthetic procedures, they are not covered under Medicare, and they are saying that this is cheaper. And also there are influence of advertisement also, a big influence of advertisement.
Of course. So how about you, Akanshi?
Yes, definitely they are cheaper, but aestheticians, they are easily accessible. They're easy to talk to also. So as clinicians, I think when I talk about my whole fraternity. We should make out a little bit more time with the patients, just not put the entire blame on them, so that we are easily accessible. We give more time to them while talking. And most of the options that are given to the clients are nicer options. They are relaxing services, like they'll give them an option of a spa or like a facial, something like that. But we will say the ugly truth out loud, which is not nice. So I think we should work on the way we are talking. We have to be milder. This is what I think we as a fraternity should be doing. At the same time, yes, cost is a thing. Social media, yes, they put out reels which are so well edited. I get hooked to them. And sometimes I like, okay, they are saying it. So you are sold there. Like, one facial can solve these many problems for me. So everyone is on social media, and they're very good with editing and all that, and it's really believable what they show online. So
So when they are going to these kind of unprofessional people, so what do you think the disadvantages are? Suppose there's a very complex plastic surgery someone wants to get done, but because of the cost and they are not getting the insurance done, they go to these unprofessional people, maybe not even in our country, in some other country. So what do you think the result is, the end result is, or what are the disadvantages that may or may not happen?
There are lots of disadvantages. In madam's topic, I know there are lots of skin bleaching creams available which are high concentration of steroid. Probably the Society of Dermatology moved against that, and
over-the-counter drugs.
Yes, it has been banned.
It's banned, but
without
in India, it's
without prescription, you cannot buy a topical
So the
steroid.
cheapest way you can become fair is by applying steroid. Okay, so you keep on applying it for
Lots
years.
of fairness creams also.
Yes.
And that destroys the skin.
Yeah, and then when you come to me, I have a papery thin skin I cannot work on. I have to.
There was a male face cream for making people fairer. That had high quality, high concentration of steroid.
Such funny. I had my engagement, and my husband, who has never ever done anything to his skin, he was glowing on the day of my engagement, and I pulled him aside because I have done so much on me, and I was like, "Listen, tell me, what have you been doing?" And he exactly named that same brand. We won't name it. It's like, I've been applying it for a week because I was getting married, so I thought I should do something. I said, "Wow, you're going to be married to a dermatologist." So it's happening with all of us.
Yeah.
So,
But then I hope it stopped after that, after you got
I
married.
made him stop.
Yeah.
I was in charge.
The price of hiring a dermatologist.
She was like, "You're married now. Don't be glowing anymore."
So it's quick. It's a quick fix.
Yeah.
So us as professionals, we give we give fixes which are backed by science, and they give quick fixes, which might not always be the best option. Yeah. It's good cosmetically, but definitely not always the best option.
Yeah, there are long-term effects,
Yes.
right?
Yes.
Which are irreversible most probably, most of the time. That's why professionals are important.
On that subject, since you were saying you are into injectables a lot,
Yes.
you see a lot of salons who are offering injectable services. How safe are they, or how not safe are they?
So I know a lot of people who inject Botox and fillers. So most of the times it's going to be okay. In fact, in the West, there are a lot of nurse injectors who do a lot of Botox and fillers. and they are certified and they go through a extensive course. But unfortunately, in our country, that's not the truth. We don't have a certification. Anyone can inject. So most of the times it's okay, but the difference does come when you meet with complications. So we as professional, we know how to take care of complications. While aestheticians or someone who's just started without even started injecting without knowing the anatomy, they will not know. They'll not know how to handle the
And
complications.
you're saying in India they're not even certified
No.
to do it.
Yeah.
So it's not certified means they're not formally trained for
No,
it also,
no.
right? So
It's like a
anybody can, like today I can just wake up and I can tell
Can
them,
start
yeah,
injecting.
I'm gonna go and inject Botox into
See, there are
everybody.
courses, but there are online courses. So how can you learn about anatomy online? We have gone through extensive training.
Few persons died after hair transplant, probably 3 in Nagpur.
What?
Because the persons who did the hair transplant, they did it cheaper, but they are not trained plastic surgeons or dermatologists. Only a dermatologist and a plastic surgeon can do hair transplant. No one else. Three persons in Nagpur probably died within a very short span.
Of time.
And all 3 went to the same person. And lot of cases of these are happening.
So when you see these clinics and they said there's a cosmetologist here, they call themselves as cosmetologists, but you should ask about the certification that they have, because there are online platforms which is given them the certification. I know people who are trained for a month online and they start injecting. So you should always see the degree, be very wise.
They don't know the complications
They
and how
don't
to
know.
manage them.
I think
Yeah.
you should tell it directly to the viewers who's watching you. And please-
your dermatologist
Yeah,
and
yeah.
cosmetologist.
Yes. Just ask for their certificates.
Yeah.
Ask how it's not the money, especially when you're doing something on your body and you are doing it to enhance your look. You might just harm yourself in a way where it is irreversible and it is the opposite of the result that you're looking for or you're expecting to see.
We go through so many years of learning anatomy, so many dissections from the first year, and I don't think it can be taught on an online platform.
It's not.
Or injecting on like a doll or a mannequin. I don't think
So it has become so commercialized that people are out there just to make money and nobody has a control over it.
It's unfortunate.
Unfortunate. Very, very unfortunate.
So I think the message to our viewers would be rather choose a clinical setup
Yes.
and make sure you are safe instead of going to somebody who says, I have a cheaper option. It might be a cheaper option, but it might be a dangerous option.
Yes. And complications can happen in anyone's hand, but go to someone who can take care of the complications.
Yeah.
Highest.
Okay. Coming to the next question. This was eye-opening, actually. And this also happens. The next question basically is, especially for Dr. Arnab, because this is regarding plastic surgery. So, a lot of time plastic surgery is blamed for fueling unrealistic expectations. Like we already spoke a little bit of it in the beginning, that, when they have unrealistic expectation, what is the real part that they are missing? Like, they see something online, they watch something on the TV, and they come and they say that, we need to do it.
The plastic surgeon should have a huge role, because he or she is the person, the patient has come. He or she should explain that this can be done and this cannot be done. This is wiser. And if you do this, there are these complications. Plastic surgeon should not be guided by the patient, but he or she should guide the patient. And complications arise in a lot of cases because of this, because the plastic surgeon is guided by the patient or being forced by the patient. I have seen one of my plastic surgeon friends who has operated on another patient who wanted a breast augmentation, but the patient had a smaller breast and the patient wanted fat filling, but that breast should not be addressed with fat filling, or it should be addressed with a silicone implant. But because of the patient's constant push, the plastic surgeon did a fat filling, and after that there was fat necrosis, continuous discharge and infection. So the plastic surgeon should guide the patient or should tell strictly that this has to be done. And what are the possible complications, that should also be explained thoroughly and in written format.
Yeah.
Should be shown the pictures, what the complications can be and what the management of the complications can be. It would take time. You can miss a few patients. Few patients can go out and won't come, but still the plastic surgeon should be safe, as well as the patient should also be safe. You don't push on the unrealistic goals, and that is not the patient who will know it. The plastic surgeon should know it.
Absolutely. Yeah.
এরকম অনেক আমরা তো মানে ইভেন সোশ্যাল মিডিয়াতেও দেখতে পাই আনরিয়ালিস্টিক গোল, lady wanted to look like a Barbie doll and
Oh, yes.
Yes.
She has got some
it become
thousand.
catastrophic.
What has happened? But I don't know what happened to her finally, because I was like, how much is she going to change
They
herself?
removed some of the ribs, I think. the
Yeah, she
lower
moved
few
her
ribs.
Last two
was
ribs,
this-
I think she
No, her hip was this thin.
Yeah, she moved the
এরকম
last two
একজন
ribs.
নয়, এরকম অনেক
Like
আছে।
she got the literal meaning of hourglass in herself. So
I
it
think
was
she was thinner than the glass. The thinnest
Yeah.
glass.
এরকম একজন, এরকম কিন্তু
অনেক আছে, yeah. Yeah, for them, I think that is their beauty standards, but it's very unrealistic.
The mirror for them is very askewed.
Yeah.
It's unfortunate, but it's very askewed.
For Dr. Akansha, I would like to know, our dermatological fixes today more about confidence than appearance? Is the trend shifting away from perfection towards wellness and individuality?
So most of the dermatological issues, most of the common issues, whether it be acne or pimples or pigmentation or hair loss, these are not curable, but they are manageable. It's always been there. So if you have a doctor who's telling, no, I'll fix you, that's wrong, because someone can help you manage it. But having said that, these issues, they take a toll on your self-esteem. Yeah, and once you improve these issues, your quality of life improves immediately. So definitely, we are looking at building confidence. Confidence is the end point, and improving someone's looks, improving and answering some of the issues like acne and pigmentation is just a tool to achieving the confidence.
Is the trend shifting away from perfection towards well-being and individuality?
Yes, I think perfection is not what people are looking at right now, because they have seen so many film stars having the right amount of fillers and Botox and not looking right.
Yeah.
And social media is not very forgiving now. They
Exactly.
capture all the angles, and finally, I think people are saying it out loud. Ki, perfection is not looking. There's something wrong with her face. She used to look better 10 years ago.
Without doing
And
fillers.
1 month ago, she had those wrinkles. She was looking better. Now everything is perfect. So now people are shifting to not the right angles, but feeling better. I have clients who've been taking regular Botox and fillers and getting everything fixed in the right angles. And right now they are like, no, you do my Botox and fillers, but I don't want to be looking made up. So a good injectable is always something where you don't look like you have been injected. So you look good, but it
they
should enhance
want
you.
A more naturally
Yes.
enhanced
Yes.
look.
Yes. So they
Rather
say,
than-
I want Botox, but I want few of my lines also to show. Yeah.
So they want that age
Yes,
also to
yes.
show, not like
Yes.
looking like,
They say, fix these lines, but a little of it should be shown.
oh wow.
So they don't want people to know, and they want to be looking better, which I think is the right way. And there has been a shift. People are more for building their skin barrier, bettering their skin texture, than just fixing few of their lines. People are more accepting of aging right now. Even if you talk about procedures, more than injectables, people are going for treatments which will help them in collagen boosting, lasers which will help them in collagen boosting, skin boosters, platelet-rich plasmas which will help them improve their skin quality. So there has been a shift.
Okay, so sir, the next question is for you. So how would you say, maybe one thing about plastic surgery, where plastic surgery plays a role in the betterment of someone's well-being, be it physical well-being, mental well-being. So in what ways do plastic surgery play that role now?
In different ways. অনেক রকম ইনসিডেন্টস আছে। Say suppose a person who is bald, we do a hair transplant, the confidence level improves. Confidence level improves a lot. That is evident in his appearance. In a lot of cases. Say a patient's face is disfigured by a trauma. So one thing what in our books it is said, what is the function of face? Function of face is basically to look like face. The most important function of face is to look like face. That is a beautiful answer. So in a lot of cases there is a facial disfigurement. We can fix it up. We cannot make everything perfect, but we can make a lot of improvements that helps the confidence of the person. There are cases of huge obesity where we can do a liposuction or body contouring that improves the quality of life as well as confidence and self-esteem of the patient, of the person. A lot of ladies who suffer from large breasts, breast reduction helps in lot of ways. Even gaining fitness also. Even gaining fitness. There was a lady who won the Wimbledon after doing a breast reduction surgery. She was unfit and could not play well, but after she had breast reduction surgery a few years back, that lady won the Wimbledon. এরকম আরো অনেক ইনসিডেন্টস আছে।
Now, from my personal experience, I would like to share this. I myself have actually undergone a plastic surgery. So I had a reduction mamoplasty in 2024. And I think from the time that I can remember, I had always wanted to get that surgery done because I felt underconfident somehow because I wasn't happy with the shape of my own body. And I felt like I was restricting myself when it came to wearing certain kinds of clothes, revealing certain parts of my body. And I always wanted to do that and feel more confident. So when I got the surgery done, I got that confidence. I mean, I was so happy. Initially, I was a little worried that, I don't know what the result is going to be. Is it going to happen the way I want it to happen? But I think a month into the surgery, I realized that was one of the best decisions of my life that I had taken. And given a choice, I would if I have to do something else to look better or feel better, I will go ahead and do it. And also about the same plastic surgery, coming to the positive part of it, I met someone in the gym. There's this lady who used to come to the gym. She was very thin. I mean, she was thinner than you, okay? And she's not very tall also, but she had really, really huge breasts. So the biggest part of her body was that, and it showed. And she seemed very timid. She was coming to the gym. She was not able to move properly. So I went and spoke to her and I told her, do you have some issues? Then she said, yes. Then I suggested that you should go for the plastic surgery because it has done wonderful things to me.
Yeah.
And I think 3 to 4 months down the line, I didn't see her for quite some time. She messaged me one day saying that I'm so thankful that I met you and you came up to me and you told me that I should get the plastic surgery done. And she plans to come back to the gym again. And I think she's going to come back more confident. I haven't met her yet. And that is why I wanted to bring this episode here, that maybe people have the misconception now that plastic surgery or dermatological procedures are a way of making money or, it's really not needed. But sometimes it is important. It does do wonders. I think for accident, people who are met with bad accidents, acid attack cases, have you come across
Yes,
any?
we have lots of
So
cases.
can you put some...
We had in acid attack cases mostly we face in government hospitals. One of our patients, she had been subjected to multiple surgeries. Now, Shah Rukh Khan probably has a foundation who is what is helping acid attack survivors.
Yeah.
That lady got help from Shah Rukh Khan's foundation, and Shah Rukh Khan once came to Kolkata for KKR match and met her.
Oh,
She
very
has,
nice.
has a photo in her Facebook profile
Oh,
with Shah Rukh Khan.
wow.
So
a very good
that
initiative.
lady is now married with a beautiful child. So she was a patient. She was our patient in a government hospital. And one thing we should not miss is that not only these straight patients, there are patients who are having gender identity crisis. In these patients, we can help a lot.
Yeah.
And it is an immense pain to live in a body which you don't think of your own. You want to be a different gender, but unfortunately, your mind is of another gender, but your body is not. We can help those patients. No one can restore physiology or change physiology, but we can at least make their appearance what they look like, what they want to look like. That is also a very big thing. That's also a very big thing.
Right. So, Dr. Akansha, you must have had patients, right, who come and they must have told you that the procedures and all have helped them in certain ways. So, can you give a few examples of what the patients came and told?
Sir,
And
as he rightly said, transgender clients who are in an identity crisis, you will, you cannot imagine how confident they become as an individual the moment they are converted. Or not only, they enjoy the whole process. They are in a different kind of high when they are going through all the surgeries and hair reduction. And we actually handhold them through the entire process. They come to me almost every month for hair reduction services, for other services as well. But they are in a different high, and they are a completely changed individual the moment they identify with themselves, and they feel all the yesteryears that they've been living, it was all,
they have been
And our
living
society is changing. We get patients. We get patients whose parents are coming for the surgery. That is a very big thing.
That's
an amazing change, I would say.
We got a patient, a lady who wants to be a male, and we did the top surgery. Her mother came for the operation, mother and brother. That is, I think, it's a beautiful thing. They get support from the family. So our society is changing. And
again, social media also has
Social
a huge
media
effect.
has
There
a
are
good
so
way.
many advertisements where they
yes,
show that this is okay to feel low because you're not feeling that,
Yeah, I think the first recognition these people got was through social media.
Yes.
They were never shown on the mainstream media. National TV, I don't think so ever recognized them. So I think with social media coming in, they have been able to open up.
Yes.
And in fact, I would like to mention here that Dr. Ornamondo's contact I was given by another doctor.
yes.
He now, but she all through her life, and then finally she underwent the procedure, and now she's a male now, and he is actually married to a woman, and he has a wife now. So that is where we have come to with
And he's working and living happily.
working and living happily.
Which I think is the point.
Yes. It's the point.
After all this, am I
Exactly.
happy? And
Yes.
that is the point.
Of course.
Yeah, and the first thing I think, even if the society or your family are not accepting you the way you are, you should still go on with it, right? Like first thing you need to do is you need to accept yourself, and then the society and the people and everybody
Of
else
course.
comes in. Right? That's really, but the progressiveness of the society that you told about, it's really nice to hear.
So we often see that where as a doctor you feel a surgery isn't ethically correct and you turn away a patient or say this isn't necessary. They sometimes turn to non-clinical but still invasive surgeries which are not clinically maybe covered, say in a neighboring country that doesn't have the license here. And I've seen pictures sometimes of horrible results. Have you actually had a patient, or do you know of a case where a patient's come back with irreversible damage?
Look, I haven't encountered a patient who has gone to some other country for an implant and then came back with implant infection. I haven't encountered those kinds of patients till now. But yes, we can have implant infections, implant exclusions, but I haven't come across these kinds of patients who has gone to any neighboring country or somewhere for this. But I have seen patients, gender reassignment patients who want to change the gender, went to a neighboring state, wanted to be a female from male, and did a castration by unauthorized person who is not even a doctor and came with severe urinary infection or retention. We have seen these kinds of patients. We have quite often seen these kinds of patients.
And in these cases, as you said, the damage is irreversible.
Yes, then we have a lot of difficulty in reconstructing the urethra and to make an appearance of female genitalia. It's difficult then.
It's difficult.
So coming to this again, I think we can go back to the part where I think money becomes a very big aspect when we consider plastic surgery. So and also the lady from my gym whom I helped. So basically, she was not going to a plastic surgeon to ask even that if the procedure is going to help her or not, because she was worried that it's going to cost a lot of money. So there is a misconception where people think that the Mediclaim insurances are not going to cover the cost of the surgery, or or it's going to be very expensive, which they are not going to be able to bear on their own. So can you clarify a little on which kind of plastic surgeries are actually they come under the?
It's a very interesting and it's an important question. I also a lot of times I face questions. A patient who had a hand injury with multiple nerve tendon injury and vascular injury. The patient party is asking me, is this covered by Mediclaim? Actually, there are two types of plastic surgical procedures. One is a cosmetic aesthetic procedure. Another is a reconstructive procedure. Reconstructive procedures are always covered by Mediclaim. If someone has a injury in the hand, a blast injury or a glass cut injury or a road traffic accident or some maxillofacial trauma or a exposed bone after a horrible accident, all these cases are covered by, all these incidences or operations are covered by Mediclaim. Most of the time. Not that plastic surgeon is operating, I won't get the Mediclaim. This is a wrong concept. And in the case of that lady also, in breast reduction is basically a gray zone between what I believe, breast reduction is a gray zone between a cosmetic and a reconstructive procedure, because the most common reason for breast reduction, it is written in our books also, is back pain. So intractable back pain.
That is the reason why I got it done.
That is the commonest indication. Next common indication is skin rash or itching under the breast folds. So these are medical reasons for which the operation is being done. So if the doctor writes in his prescription stressing these things, that these are the reasons for which the lady is being subjected to this procedure, I think actually it depends upon Mediclaim companies also. Companies, the amount of insurance and all. But
they come they can go for a claim for it, like
of
whatever,
course.
rather than not thinking that
I think they can claim for it because these are medical reasons.
Yes, absolutely.
I think it's the need versus desire. If it's the need, you get
and the doctor should also help the patient
for your desires.
giving the stress in the prescription.
In outlining that it is a requirement
this
in
is
the case of a
the
patient.
requirement. For this it is being done. This is not a cosmetic by choice procedure.
Thank you for
So the viability in here, the medical viability decides whether it comes under insurance or not. So you have to first, as a doctor, define for the patient.
It's
That's
our
amazing
duty
to
also.
know.
It's our also duty.
Yes.
Because the persons who are in the desk of the Mediclaim, they are not medical persons. Most of the time, they are not medical persons.
Yeah, they normally ask for the reports and what the doctor has written.
Even sometimes we have to talk to them also.
Oh.
The Mediclaim company, they call us. Yes.
So, thank you for clarifying that. I think that's going to help a lot of people who want to get the surgery done, but they don't know if they should go for it because of the need of the money. How do you explain that healthy skin doesn't always mean fair, flawless skin?
Yeah.
So for you, so we have already spoken about where a lot of patients come to you for a better complexion, you would say a fairer complexion. So how would you explain to them that having a perfect skin or complexion doesn't mean you need to have a fair complexion?
It's very difficult. So the only thing I have to do is reinforcement, talking to the clients, patients again and again that your skin is not meant to be perfect. It's not a filter.
Yeah.
It's not a filter in your social media or your reels. Your skin is meant to have texture. Your
Yes.
skin is meant to have pores. Your skin is meant to have spots. The reason that you're having a spot because your skin is alive, right?
Yes.
So good skin is about barrier. It's supposed to protect you. It's supposed to show changes. That means your skin is responding. So it's very difficult to make anyone understand that this, your skin doesn't need to be flawless. Work on your skin quality and not on the color of your skin. So I think a lot of it comes from just talking again and again, rapport building with your patients.
So here I want to ask that if a person is undergoing too many procedures too many times, like, if like you said, a lot of people come, they have used steroids too many times and the skin thinning has happened. So would you say that if they're undergoing a lot of procedures without knowing what the end result is, then I think instead of looking better, a few years down the line, they might not look what they want to look.
Yeah,
right?
it's just not about the procedures, even skincare. Skincare has become crazy in the since COVID.
Yes.
So people are just looking at reels and they're choosing the ingredient. They are like vitamin C. So sounds really good. But vitamin C is not for someone who has sensitive skin, someone who has a lot of purging and acne. But vitamin C, they feel it's a vitamin. So let's just use it. So they're using it left and right. So I always say research on your ingredients. If you're someone who doesn't know about your ingredients, consult someone who knows about your ingredients. So skincare, simplify your skincare regime. Don't be someone who buys like 10 products, uses it for 1 month and then ditches all the products. You need to be consistent. It's just like gymming. You gym for 1 month and you lose 10 kgs and you stop doing. There's no point doing it. Instead, be very consistent. If you're doing 15 minutes, do the 15 minutes consistently for, as long as you can. And your results are not going to show in like 1 month. Your consistency is the key. You go to the gym, you lose 2 kgs, you're going to feel better. You're going to feel active. But only when you lose 10 kgs or you build proper muscle mass, someone is going to look and applaud and say, okay, something has changed, you look better.
Exactly.
Same happens with skin. You go through 1 month of good products doesn't mean that your skin is going to change overnight. You have to be consistent. So yeah, even with procedures, people when they come with damaged skin with steroids, or people who have been to cosmetologists and they've done procedures left, right and center, we actually give them a period of not doing anything, just applying moisturizers and, healing your skin, or sometimes maybe doing something like a PRP, which is platelet-rich plasma, healing your skin with your own plasma, something like that, before subjecting them to
More procedures.
more procedures. And most of the times nowadays, when I meet patients, they are on too many products, too many actives. So they are doing harm. I say, don't do anything. Just wait. It'll heal. So they are on too many active ingredients, because they see one retinol one day in an ad, and then they see a vitamin C. They're doing everything. They just say, even the companies, they say pigmentation, and they're giving all the anti-pigmentation ingredients in one product. So you have to be very wise, and I say that on camera. You have to be very wise and know where your money is going. Don't just spend your money on something which is going to worsen your skin. Be wise and know your ingredients, what you're putting on your skin. First, know your problems and then your ingredients.
Exactly.
Yes. Thank you so much for that.
So you would say, instead of committing to a 25-step program that we keep seeing
Be
online
consistent, use your sunscreen and moisturizer.
nowadays, there you have it.
I think most of the people, they just follow, it's like dieting. They diet, they lose weight and they stop and eat whatever junk they
it's back again.
Same with skin.
Here's one myth for you about plastic surgery and one myth about
Skincare.
I have many.
You can go for more than one. I have no problem with all that.
Because I hear this so often, every
The
day.
most salient myth.
Exactly.
So one is, let's go herbal. Let's do everything DIY and from the kitchen. So they apply tomato, everything in the kitchen, everything. So they are all for herbal, but nothing is really herbal. Everything is science. Everything is physics, chemistry, biology. So even if, all the products which say herbal, they're actually not herbal or natural if you want to be. So that is one. Sunscreen causes cancer is one.
Sunscreen causes cancer.
Yes.
That's the first time I have not heard anything
So
like this
the
before.
thing is, our mothers also, even they tend to say, "Ki, we used to never use sunscreen. What's this whole trend about sunscreen?" But they were not subjected to so much of blue light like we do. We are constantly in front of a screen, our phone, iPads, everything. So we need this light.
That's light right now, yes.
So third one is laser will damage our skin. So yeah, they don't trust any lasers. Fourth one is we don't want to start with any procedures because once we start, there is no end to it.
Yeah.
So they feel like if I've taken a treatment and if I stop, I will age faster. That's not the truth. You have to be under the guidance of an expert who will guide you through your journey of you feeling better in your old skin. So yes, these are few ones which I remember.
It's a very, very relevant view that
And
you
I
have
would
just
like to
brought.
add another.
Yes.
Is that nothing will be changed overnight. If you go to science, it takes time. If you go to, as you said, to the non-qualified persons, they can claim it can
Instant
change.
fix.
Instant quick fix.
Yeah.
But if you go to science, nothing can be changed overnight. It takes time.
Yeah.
It takes time and patience.
Of course. I think even plastic surgery for that matter, it takes a lot of time to cure, heal the marks, remodel.
Yes.
Yeah, and that also after the surgery also you need to have a lot of patience.
Yes.
Yeah, and for the procedures that the beauty clinics, the kind of procedures they give, for that also you have to continue. It's not like you go for 6 months, you see something getting better.
And there
So
is some amount of homework which even you are supposed to do. So it's not just one, it's a team effort and it's a journey. It's not one day.
Okay. And a message for you, what would you, a message that you want to give to our audience that if they want to do a plastic surgery for any reason, for a beautification surgery or for looking better or anything at all, what message you would like to give? And also along with that, it's not just the surgery, the other things that they should take care of if they want to go for the surgery.
I would like to say that go to a qualified cosmetic dermatologist or a qualified plastic surgeon, number one. Next is don't have any unrealistic goals. Stick to what your doctors are saying and be happy as you are. That is the most important thing. Be happy as you are.
Yes.
If you are happy with how and what you are, that is the best thing you can have.
Of course. And Akansha, what message you want to give to the
I
people
would just
who
say,
are
treat your skin like an organ. Yeah. If your skin is falling apart, doesn't mean that you are falling apart. It just means that you are alive.
Yes. Thank you so much. And with that, I think there was a lot of knowledge about things we have never heard about. I think for me, it was absolute pleasure having you both. And I think we both are very happy that we could bring this topic where I really wanted to. I am very thankful to plastic surgery for whatever confidence I have gained personally. I don't want to go for dermatological treatments, but we have very little time, in today's life and work. But I think it's needed, right? A little bit of care here and there is needed, but not to go insane over it. That you want unrealistic, you have unrealistic expectations, not like that. But to be positive about yourself. I think both of them are important, but you should go to the experts always.
What I'm taking home from this is nothing comes overnight, as you all say. It's a process.
Yes.
Trust your experts and do what they ask you to instead of
Exactly.
just looking online and thinking this is my
I
fate.
think since they are the experts are here, I would also like each of you to give a message to the people who body shame and troll. in person, and then I think it is very
That's very
important.
important. I
So
think
can
some
please give a message to the people who are sitting there doing nothing and just body shaming others
I
and
would
trolling
not like
others.
to give a message to people who are body shaming. The society is always there to put you down. I would say just build up your confidence, stand up, wear those heels, go out there and just not be bothered.
Yes.
Yeah, because
Yeah.
body shamers are going to be there. They are there to put you down.
That is what I also want.
Yes.
Thank you for
Same
putting
thing.
it.
That was really short. Sweet. So the point is, do not pay attention to the body shamers and the trollers online in person, because they do not deserve the attention they are looking for.
Exactly.
Yes.
Love yourself and be what you are. You're the best. That's all for today. Thank you. Bye-bye.
Hope you're enjoying what you're watching. If so, then like, share and subscribe. And do not forget to press the bell icon for notifications.